all that.
And their caretakers. We are here discussing 120 million in a period of 2 weeks. And our real brothers and sisters whom we share DNA by creation, association, and biology are telling us there is no other option but this money we must produce. Of course, you forgive them for one reason. They are exploiting a gap that government has left. Because if we had planned properly, most of these numbers would be absorbed by government. And if these numbers were absorbed by government, then a smaller number would be left. And these facilities would be scampering for it and competing and would highly maybe subsidize and incentivize their clients. Unfortunately, to the contrary, because we did not plan it properly, it is to the other way around. The facilities, government facilities are full, and now we are running to our brothers and sisters who are private providers. And of course, we interfaced, and they had their genuine concerns like medicines. And of course, they talk about allowances. Perhaps they have the liberty to keep telling us many technical things because they run their own businesses and we may not have the liberty to examine them. But I can tell you, if we examined even the risk allowance being talked about, if you examined some of these nurses that serve in some of these private facilities, you may be shocked that even the risk allowance they get is so alarming because they all blanket it. The risk allowance is so high. No one will mention. Of all actually we met, I did not hear anyone risk to mention the risk allowance. They mention the word, none goes into the figure. Because it is the word that we can appreciate very fast and feel sympathy for them, and of course to give them liberty to continue pinching us deeply in terms of finances. But we even requested them. Now, you're talking about these subsidies. They proposed very, very serious issues that I consider very critical, that the government should look at. To subsidize on a few things for them, to give oxygen, to provide PPEs, to provide PPEs, and many other things, and to actually put VAT, pay as you earn, off their salaries. That for this time they shouldn't pay as you earn, and many others, which partly I agree with. But my sister and the team are very intelligent and very shrewd businessmen and women, that they do not tell you that after doing this, the cost will reduce by this. There they don't go there.
So they're not giving the lines of...
They don't. They will tell you, just do this. They are not telling you, after doing this, expect us to go down. So the return on investment also is not clear, even when we want government to do it.
Have you put them on the spot to ask them that list for us how much you give, for example, in risk allowance to how many people stay around a patient ideally? About 10, 8?
What? Stay doing what?
I mean around a patient, a COVID patient, who care in intensive care.
It's one person per patient.
No. There is the intensivist. The intensivist.
Intensivist?
There is critical care nurse.
Critical care nurse? I want to have your question answered.
Okay.
With something specific.
Intensivist?
Intensivist? In critical care nurse?
They will need a physiotherapist.
Physiotherapist?
They need sometimes a nutritionist.
A nutritionist?
Yes.
Does a person in intensive care eat?
How do they?
Okay.
And you may need an orderly. Now this is on the bed.
That is, those are 5?
Yes.
And
I'm not going to get out to securities, billing, what?
Okay, 5. 5. So there are 5.
You see,
but they are still mentioning now risks. risk allowance for 5 people, is it possible that, Dan, you engage and put on the spot people like Grace and say, on risk, can you reduce it from 500 to 200? On maybe what else? On medicine, what medicine are you giving? Can you put them on the spot for that, or have you done it as Parliament?
First, before you put them on the spot, let's first put them on the spot now. How many intensivists do we have as a country? Before you have 10 for 10 patients in one hospital. As a country, how many intensivists do we have?
I counted you 68.
68.
You said there were 68.
The whole country, including government. Now, where do you get the ones that you put on every patient?
Government, you don't own him completely, that you are not going to, you're going to stay here forever. He may give you the 8 hours and go to the next hospital.
Which is of course also very wrong.
No, but even in a hospital, doctor, I need to help Dan even, address that point. Because if you say there are 68,
the whole country.
The whole country. Yes. And in a hospital, and you were counting, that counting you were presenting was for a patient.
So where
now, there are some hospitals, like the other time I know, a hospital like Kololo would even have 30 people in intensive care. So meaning you are supposed to, ideally, from my layman's understanding, you are supposed to have those 10 or 30 around the person. So is that
around?
That's what we talk about a word round.
For me, yesterday that was my argument. And of course in their medical language, they skewed my point. I told them, what you're presenting to us is what you studied in the book. That a patient in IC should have the following people taking care. Now, we are looking at Uganda, and we are talking about Uganda.
Practical challenge.
He has told you we have 68. Mulago, Mengo, Zambia, and her fraternity. But these 8, they multiply by the number of patients in these whole facilities, and they are counted as a serious key cost driver to cause the cost to quadruple.
I don't know if I'm understanding him, because if I'm
understanding Dan.
What if I come to your hospital and you review your patients, all patients, should they be paid?
No, you should. Except, you know what Dan is driving at is this. Dan is challenging you and saying
they should
that
be paid on a consultancy
you
basis.
are being,
they are charging for what they don't offer.
Unreasonably and overly expensive in charging Ugandans who are suffering. This is what he's saying. That when you are a doctor, or let's say intensivist as you mentioned, and you come, let's say, to Kololo Hospital, if there are 30 patients and you are charging for each patient that you are doing a round, you're charging, let's say, what is the ideal that you pay for a risk allowance?
For the day? For the day.
Yes, for the day.
Risk allowances are paid for the day. And
for the day, how much?
It's between 150,000
to
200.
To 200. If you're saying, Dan's complaint is that you're saying you pay, if there are 30 patients, the person is going to move around, and for every patient you are charging 200, 200, 200. Why don't you, for example, because we are all suffering, say, pay me 500,000 in a day. I mean, pay 500,000 and let it be for all the patients, so that 500,000 is spread to the 30,000, which becomes, say, is it 20,000 that the patient will pay?
If I can graphically put it,
yes,
is that what they charge for, they don't necessarily offer it. But because they understand the trade, they have the opportunity to charge for it. And no one will ask for it.
Two,
On the other side, they have a point, and they made it very clear, even yesterday, that of all money, and this is very disheartening, of all money that government has set aside to as economic stimulus, the money in the Uganda Development Bank, money in UDC, the money in everywhere, none of the health care providers has accessed this money.
It goes to Akamwesi.
This money goes into malls. This money goes into hostels. You know, these things are very unfortunate. And at times when I want to get annoyed with the exploitation of private actors, then they corner you because they have suffered alone.
But where does that leave a citizen?
I mean, that's what I'm saying.
The two elephants are fighting.
Yes, they have suffered alone. And literally they told us, but in a very polite language. But I think one of them actually was more clear. That you suffer, actually I think it was one of us on our side, who is a doctor. You suffer alone, establishing everything. They are choking on loans, like they were telling us. If I'm not mistaken, Mrs.
So COVID is an opportunity to pay off the loans.
Certainly you can want to frame it in such a way. But what was so disappointing that I thought would examine further as government and as a country is that they told us that it is almost the same for them to access money from a commercial bank. They almost access the same money on the same terms from UDB and the rest of the facilities that government has provided. And for me, I find that very, very awkward.
Okay.
First, before you...
Okay, then I need to bring in the panelists. I have discovered that Honorable Margaret is also online, and I want to bring in the panelists and get maybe two minutes from each of them, and then we take a break, and then I come back and we respond to some of these challenges that have been posed. Let me start with Sarah, who is here in the studio, and then I'll bring in Gobi and Margaret Muhanga, the minister designate for primary health care. That is important to have. Sarah, you are now clear in your mind from what the doctors have said, the health care providers, and what the MP has said in their encounter. Doctor actually even referred to it in terms of, in reference to West Nile. Ugandans are on their own from what we have been hearing here. What is your view?
Well, Charles, it's very unfortunate that at the height of the health pandemic, where everybody is supposed to prioritize health care, we have the mafias sandwiching a citizen. You have mafia on the side of government. We know how the COVID funds were squandered in the first phase, and the unanswered questions even raised by...
The use of mafia is in reference to what? What does it mean?
People who only care for themselves.
Okay.
The selfish, maybe we call COVID, the exposure of the selfish extravagantists in Uganda. No, I'm coming because I am here. I'm the only Muntu. I'm not here to spare anybody. Even me. No, I'm not here to spare anybody, and I'm going to speak.
Don't associate with Grace in the Muntu debate.
I know what you mean. Those other countries that have managed to contain and defeat this pandemic have prioritized access, universal access to health care. You can look at China, you can look at Thailand, you can look at European countries, you can look at whoever has succeeded to save the lives of their citizens. Priority number one, universal access to health care, removal of all financial barriers to access to health for all. The wishes of the government under the first phase looked honest and genuine. But the acts they did, unfortunately, that are now exposed, have been exposed by the second wave. I think half of the hospitals have run out of drugs. They don't have PPEs, and doctors and nurses are dying. Dr. Mahereza mentioned 18 doctors, but the Nurses Association have mentioned that they've lost 50 nurses to COVID, and majority of them unfortunately, lacked access to health care. So you can only equate their death to, I don't want to sound like the cabinet of fishermen, but I know that it's Jesus who was the king of oceans and all water bodies, but he lacked water to drink on the cross. So we have also another example of the doctor who was in charge of Mbarara University Hospital, in charge of the COVID unit, that died because he was denied emergency healthcare treatment for lack of money when he was transferred to Kampala. Very, very unfortunate. If you revert to the laws that govern medical practitioners, Section 8 of the Uganda Medical and Dental Practitioners Council Code 2013 makes denial of emergency treatment to a patient a crime.
Where does emergency stop?
No, you will come in, doctor, you'll have your time.
Exactly, but
you will have your time. No, let me first submit. You'll have your time. I'm just citing the law. When you got Section 42 of the same law, medical practitioner, they are required to demand for reasonable charge for medical services rendered. And the question we are talking about here is, are these costs reasonable? And this is also prohibited under the code that governs their conduct. When you go to Section 121 of the Penal Code Act, it is a crime to hinder burial arrangements for a dead body, and it's punishable by custodial sentence of 2 years. We have had many private hospitals detaining dead bodies. I think there are 2 cases.
No, those are the pronounced ones.
Those are the pronounced.
No, I know these are the people who have gone to court. We have a case in a hospital in Bugolobi where even the people were told that their dead body has gone missing. Very unfortunate events that are prohibited in our laws of the country, so that people can take on these practitioners. But away from that, I wish to really share the sentiments by Honorable Chimosho that is advancing on the show. If you are a medical practitioner, ICUs have not started today. They have always operated and people have access to them before. What has changed? Are that COVID medicines costing so much money? And how much is it? Can it be mentioned? We know that it can change tomorrow, but I think it would be useful for the viewers, Charles, to mention the essential drugs used in the treatment of COVID and how much they cost as of today, so that the citizen can try to make sense of what is happening in the private hospital, But away from private hospitals, Charles, I want to underscore the fact that management of a pandemic is a responsibility of government. Private hospitals only play a complementary role to the duty of government. In an ideal situation, private hospitals should be accessed by the middle class and the rich. But because we have a crisis in the government hospitals, going to a government hospital is like a death sentence in waiting. So everybody is rushing to the private hospitals because of the deficiencies and inefficiencies of government. So the citizen should first get extremely angry with a government that cannot provide essential health care in a public health emergency.
Okay.
Second, Charles, Parliament passed the Public Health Insurance Scheme bill, which would help lessen the burden of a citizen in ensuring everybody can access health care, especially under COVID. The president has not ascended to it. What are his reasons amidst a health emergency? What are his reasons of sitting on that bill that is critical in facilitating health care to the ordinary citizens?
It's a good question for Honorable Margaret to...
Charles,
yes?
I wanted to put one point to information to her, that while we are condemning government for maybe failure, it should also be on record that all these health providers, the last point of resort, most of them will refer to Mulago for case management, where everything has gone bad and they cannot manage. That also should be on record. That credit should also be put to Mulago. And
very important. Let me bring in Gobi, and then all the issues that have been raised, I will ask Honorable Margaret Muhanga to respond to some of them. Gobi, are you online?
I'm here, Charles.
You have followed the discussions and how heated the issues are coming out, and I want to bring in your perspective. What do you think can be a solution to the problem that we are seeing? Of course, I know you have a number of other anecdotes of the costs, the challenges in the health sector, the provisions by government, and then Dr. Muhereza has thrown in another spanner in the works, you know, to compare the number of ICU beds with the number of MPs, comparing the number of the living ICU beds in the country, in government hospitals, to the number of cabinet ministers. A new perspective altogether, though controversial. What is your take?
The truth.
The truth, Charles, is that in this country today we are discussing health crisis. A few years ago we were discussing economic crisis. A few months to come we shall be discussing another crisis, because crises are like buses. Another one is always coming. I think as a country, we should stop relying on goodness of man. We are over-relying on the goodness of man to provide services or solutions to our challenges. And yet, we know that human beings, at least as economists, know that human beings respond only to two things: incentives or danger. We over-relied on private health care in order of providing solutions to people. And yet, as I talked here some few days ago, we know that all countries which have provided good health care systems, they have ensured that they treat health care as a public good, which should not be excluded and also not rivaled in consumption. So the first thing we have failed to do in the country, in my view, we are treating health care as if it is like tomatoes, which you should do. Even tomatoes, in some countries, they are treated very, very carefully for issues of safety and so on. Here, we left health care to be, determined by whoever is providing it in terms of the pricing, in terms of the quality of the health care they are providing, and so on. We don't even know the unit cost of anything. You can see the kind of conversation we are having. Healthcare has turned into a very lucrative business in the country for those who are providing it. Uganda is running as a mirror image of the US, where they are having very expensive healthcare, treating it as a private good, and more so when it is poorly provided. So my view is that government needs to really use this COVID-19 as a wake-up call on investment, first of all, in the sector of health, but also in ensuring that the health care is regulated. We know we are running in this country the economy and the society without rules. Even when we write rules, we don't enforce them. But this shouldn't happen again. The law investment in the sector has to be looked into. The good thing, we have a minister on the panel, and I'm sure the entire government is also listening. We need, in my view, I think, out of the guilt for failure to invest adequately in the sector and also to subsidize the sector, government has left the private providers to run their facilities not only on full cost recovery model, but also on full profit maximization model. They don't want to interfere with them because they look at them as helping us to fill a gap. And to me, this is something we shouldn't really allow to continue this way. Government must subsidize those private providers and then enforce the regulatory framework to regulate on how they price, how the quality of the service they provide, but most importantly, how they price them. Some of my students know I've been saying over years that in Uganda we have too much market and too little government. While government is doing some things that it is not supposed to be doing, it is also not doing some things it is supposed to be doing. And one of those things it is not doing is regulating the economic agents. And now this is just an example. I remember one time I got opportunity to talk to the leaders in 2016. The cabinet then had a retreat. I talked to them and I told them it is wrong for them to leave public services, things like education, like healthcare, in the hands fully of private sector without government subsidizing and regulating as well. I think it is only the education sector, the minister and her sector who responded, and they started. You remember that craze we used also to have with the school fees. People not only asking for school fees, but asking parents to bring, wheelbarrows, to bring cement, to bring toilet rolls, like as if they are a kid was going to start a kiosk at school, and also asking, very obscene fees, 2 million shillings for a child to learn in kindergarten, or just to cry around the compound. And these are some of the things which we need to really look into. And now the health system, much as the medical fraternity might want to justify the costs they are asking Ugandans, it's simply unacceptable. But me, I don't blame them. They are just taking advantage of a system which was told to liberalize, and they took it literally to think that liberalization means also deregulation, don't regulate. A system which was asked to open up the space for private sector, and they took it literally to mean that they should black out the door and throw it away. So they have left the private entrepreneurs to run hospitals as if they are, running them on the model of Julius Caesar.
Okay.
Who ran fire extinguishing company during those days of the Roman Empire, and in his company, he used to negotiate the price when the fire is burning. Finally, I think the low trust in government facilities also is a problem. I've heard my good friend Sarah saying that, you see, the reason people are going to private sector because in the public sector it's like a death sentence to go there. And yet actually, the public sector facilities, many of them offer better service. And all of those doctors that we run for, and even some of the facilities we want, they are in the public sector. Like in this issue of COVID, you'll find that there is no better place of treating COVID than Mulago. But someone will, and is in Kampala here, will not even inquire whether he can get a bed in Mulago, and he goes to a certain private facility where they are charging them 15 million shillings per day. And that is the challenge we are having. The trust is low. We have over-politicized ourselves. We think even the health care system is also having color, that it is for movement, and then opposition should go to private, to the other private, or even some people within they say, I don't trust that one, let me go this. So all of those mistrusts, we need also to deal with them. Thank you.
Thank you so much, Gobi. Let me bring in the minister designate, Honorable Margaret Muhanga. You have listened to your colleagues and attentively, I guess, and the issues of profit maximization model, the issue of no government in cases where it is supposed to be very present, and the issue of trust being lost, and then the issues of the challenges that the healthcare providers, especially the private ones, are facing. Do these challenges sound familiar, Honorable? And you are headed now, I think you are going to be sworn in tomorrow or the day after. The other day you could not be sworn in. But you are headed for a ministry that, that you must start, you know, firefighting immediately. What's your take from that perspective?
You know, Charles, over the years, I have learned to be very patient with a lot of issues and a lot of people. It is so easy for any of us to be a bystander, criticize, throw tantrums, meet anger on sometimes the wrong people. But I am glad that Dr. Gobi, at the end of his story, he has said that up to now, in spite of all else, many people trust government hospitals. I mean, people don't have trust in government hospitals, but the best care still is in government hospitals. The best specialists, the best professors, the best equipment is still in the government hospitals. Problem with us, the Ugandan elite, I think it's a problem everywhere, because I've seen it actually everywhere in the world. We like to criticize where we are not. Where we are involved, we do not want to criticize. When you see the government hospitals right now, the way they are, they could treat any diseases that come by, save for a very few specialized things like heart surgeries, kidney transplant. But they can even do now, they are treating cancer very well in Uganda through the Mulago Cancer Institute. And many people can give testimonies. But because they are poor people who have not got the chance to come to speak to us, those who have gone through the government hospitals, we don't get to know the stories, the very credible stories of our doctors. My daughter is a doctor in Mulago Hospital. She's doing the last internship. She tells me the things she goes through. She works the whole night sometimes and the whole day. I have not seen her for 2 months because she's too busy saving lives. And then you hear people abusing doctors, saying anything they want. I get so frustrated. But you see, for me, I have a saying that spectators are the best players. Those people who speak Rutoro Runyankwele, they say atamukwasire Agiri Karaha, you just stay there, it's all right. But you are not the one holding this person. So people have gone through too much. Our doctors need to be applauded for what they have done, especially in our government hospitals. Now let me go to the private hospitals. I saw some young man yesterday speak on NBS, I think, in the morning of yesterday. And he was explaining casually that they are business people. They want to charge anything they have to charge because they're in business. But I said, wait a minute. I have two daughters. One has finished medicine. The other one is still studying medicine. They always tell me their first course is always to tell them, take care of people's lives. Do not let somebody die because you lacked something. Do anything you have. That's why sometimes they even breathe into these patients. But somebody says, oh, we are in business. A bed, I hear in private hospitals, just for one night to sleep on their bed, even if they have not given you any medicine, is about 300,000 just to spend a night in a private hospital. I live in Sheraton. What have I taken from this bed so much so that you charge me all this money? Somehow, we need to, what the Uganda call, trade the call. Think about it. What if you charged 100,000 for someone to spend a night? Because let me tell you, Charles, 80% of the COVID patients do not need hospitalization. Actually, more than 80%. Even those who run to hospitals sometimes are not so bad off, but they go there out of the scale. We need to restore hope into our people that COVID is not a death sentence. COVID, first of all, for the little medicine I know, is that it is your body that will fight back. No amount of medicine may resuscitate you, or it is your body as the first line of defense. You must boost your immune system. Or if your immune system is good enough, now we have known COVID for over a year. Dr. Kiza Vesija and other doctors have been telling us, have your immune system boosted. Eat this, do the other. If we did all this, that means you can manage COVID from home. I have so many families in these 2 weeks that have been having COVID and have managed from home. Very many. Even my auntie, who they said died of COVID, I think my brother just tweeted it out of fear. She didn't die of COVID. Auntie Damari died of high blood pressure. She didn't die of COVID. And so, although the whole family had COVID, they are all doing well. Her husband is over 70 years. He's doing well. Today we sent her, we actually did her the last farewell today. So COVID is not a disease to scare anybody. Let's first restore that hope among our people. Because people rush into hospitals, others have hired airplanes, they've gone abroad, they are running to other hospitals. But where you are going, there are more people dying there than they are dying in Uganda. This disease, no one prepared for it. Even the mighty United States of America, where 24% of the world wealth lies, they are the highest in number of deaths and even number of sick. The COVID took them down. It took the best healthcare systems down completely. In Europe, look at a country like Germany. Did you expect Germany to go down with COVID? Or Italy? There's a time when there was no bed in ICU. There's a time when there was not even any hospital, private or government, to admit patients. So what do you think about poor Uganda, whose economy is smaller than just an individual in the United States? An individual are not even the richest, the Bill Gates, the Page, here, Rockefellers and the Walmart. These middle people, middle billionaires, all their systems went down. You cannot keep throwing stones at government. They have failed. When have they ever worked. The day you reach these hospitals and you are treated is the day you will appreciate that we have good doctors, we have caring people. We have reached an extent right now of losing our own health workers. Our doctors are dying. Nurses are dying. The population itself is not listening. I sometimes think COVID is a disease of behavioral change. If you don't get close to anybody, if you don't insist on going to town when government has said stay at home, this COVID will be no more.
Okay.
I've had arguments. I live in the suburbs of Kampala. When I am leaving home, I find people seated in front of some shops, drinking from one glass, playing matatu, or these other games or mweso or anything, drinking. Even in the morning, are these ones mere alero? They are just super spreaders. Wear your mask and you cannot wear it. And then a policeman has got to chase you to ask you to wear a mask. Really?
Okay.
Are we being fair?
Honorable.
Are we being fair to castigating government? This government. What have you done? What is your personal responsibility as an individual citizen of Uganda? Why are you looking up to government to do for you something? What are you doing for it to make it better?
No, Honorable.
Now, lastly,
Honorable.
yes.
I think
Charles.
I think for me what is also most important is that you are heading into a ministry which is the critical ministry to handle the COVID pandemic, and there are things that we don't need to ask from government for sure, but I think that it is okay for the public to demand, and especially MPs as they are here, the health service providers, to demand and say, first of all, to diagnose what is the problem. If the problem is the predatory kind of costing by the private sector, private care, healthcare providers, the question will be to ask, how did we get there? And if one of the excuses or one of the reasons or excuses they are giving is that we are charging for PPEs, protective equipment, personal protective equipment, if they are charging for drugs and the public or parliament, our people's representative, are saying that this, if government provided, if they are saying one of the extra cost is because of power that is too excessively charged, then there is no way we can run away from holding government accountable. The issue here is every Ugandan should get equitable access to good or basic health care. But that is a public service. Or can we ask ourselves whether health is a public service at all? If it is not, let's agree on that. If it is, then we have to demand that government should be accountable for that. Make that last point in 1 minute, okay, and then I call for a break. Yeah, make that point, Honorable Muhanga.
Okay, Charles, what I want to say is that they are really right to demand, but just know that this is something that caught us unaware. We prepared ourselves, we thought this would work, but it didn't work. It overwhelmed everybody around the world. But for us, as leaders, now for the MPs, especially now I've seen my brother Dan is in parliament, you will see the challenges of government and you will not believe it. Challenges that sometimes cannot be managed so easily. But for us, we think it's so easily managed. But there are some challenges that government has been facing that are not so easy. The money is not enough. But even that one which we have sometimes goes to some things that are not really necessary. I've seen members of parliament, and you are going to meet these challenges, Dan. People of Kazu are going to ask you, how can you help us? We have a health center for. You won't sit bleeding and go to buy a car. in the last parliament, the money that they gave me to buy a car, I used it to buy an ambulance for a health center in my constituency.
Okay.
All these challenges, you will find them. So also, some doctor, I've forgotten his name, who said, you see, there are many members of parliament. They have all this and the other.
Dr.
If you see the challenges of these members of parliament and how they push on a lot of things from their own small earnings to help where services are required, you will not even want to be a member of parliament. They are judges in their constituency, they are the magistrates, they are the funeral directors, they are the reverends, they are everything. They are the doctors.
The funeral directors. I like that part.
Really. They are on streets immediately after losing an election. If they really earn well, how come they are so poor?
Okay.
I've not seen an MP thrive for long after they have left parliament. They don't.
Honorable, let's go for a break. I'm going to come back to the studio after the short break. I just need to take a breather, and in that next session, we will be looking at now what is the solution, what is the future, and what can be done by both government and the healthcare providers. Of course, government has to weigh in here really heavily for a solution, whether it is regulation, whether it is like Gobi has said, or whether it is subsidies, and where does government come in to prevail and to interfere with whatever challenge is going on. Let's go for a break right now. When I come back, you, the viewer, as well, I will be reading your comments and questions, and then we shall respond to them in this discussion. The discussion topic is the cost of treating COVID-19. What are patients paying for? Let's take a break now.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines, and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from a SANE project.
Man, guess what happened yesterday? I entered the what? The taxi. But the pregnancy is from the what? The generator. Then my phone does toot, and the toothbrush breaks in the what? In the porridge. Then I call who?
Wait, what?
First wait, I am still telling you. Then the jerrycan does what?
Love to talk? MTN My Paka Paka now has more minutes. Get My Paka Paka voice bundles to talk and talk at no extra charge. Dial *160*1# to activate My Paka Paka.
Everywhere you go, MTN.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
Short break. This is Behind the Headlines this Wednesday, 7th July 2021, and this is Behind the Headlines. My name is Charlse Odongotho, and we are discussing the cost of treating COVID, what Ugandans are paying for, and we are asking the questions: is it the drugs? Is it the power? Is it the oxygen? Is it the counting of risks that the doctors and other service providers or patient caretakers are faced with that is causing all these costs? I was comparing to Kenya, and they are not very different, and they told me that one day they charged one of the patients in intensive care 200,000, which is about 6 million shillings per day. And our average, the ones I've been hearing, are 3.5 to 5 million. But still, it's like the rest of the panelists have said. There is an issue of financial incentives. There is the issue of the facilitation. There is the issue of the entire medical or health service provision in this country. It is a systemic problem, or is it actually a question of the private sector going haywire and saying we are unregulated, free market? And free means really free, as Gobi wants to put it, that when they said there is no, that it is liberalized, then you pluck off the doors. We have questions that have come from some of you. I'm going to read some of them, and then I will bring the panelists back into the discussion to respond. Some comments coming on Twitter. Aburek Eric Ongodia says we can have COVID treatment going down by building oxygen plants here in Uganda as an urgent measure. And then Naku Makubuya says, let every family Abi Naku says, let every family buy and use Covidex. We don't want any more deaths. And then M. Runenga says, it is unsustainable to pay out of pocket. The question of mandatory health insurance needs to be addressed sufficiently. By the way, Grace, you need to respond to the issue of health insurance as well, because I don't know whether it was Sarah or Honorable Dan who raised it, but I know that the insurance bill was passed, health insurance bill, but we discussed it here, actually, Sarah, you recall, when we discussed the health insurance. Yes. And the question was that the insurance providers were decampaigning it and actually probably were lobbying the president not to sign it, to assent. So why is that so?
What is their interest?
She's here.
So you will respond to that. I don't know what the interests of the insurance providers are, but they are industry players. So we need to. Grace, you will respond to that in your time. Then Christmas Turio Murugendo says our leaders should rethink about people they are leading and refocus on the national health insurance policy. So the health insurance policy comes back here again to cater for all Ugandans, both rich and poor. And for me, that is the point, you know, the whole access, equitable access. Equity means both rich and poor. If you're talking, a friend, I didn't get his permission to declare, but a friend lost 2 sisters in the first wave last year. And one stayed, I think, in hospital for 2 weeks, another one for about 5 weeks. And the total bill went up to 200, beyond 221 by the time we checked. That's incredible, unbearable, unreasonable. You call it anything, unacceptable in a country like this. So how do the poor really get money to pay for such? Then someone says, let's focus not on money, but on saving lives. I think the horse has bolted through the door. Now the issue is we must see how to solve this problem. It is now the question of discussing the cost. And then another person says, hospitals need money to improve their services. If you think that they overcharge you, try and compare the prices charged abroad. Dr. Honorable Dan has already compared to India, and I don't think I have to belabor to do that. An IC bed costs well above 300 million. Is that so?
Let me explain.
Grace will respond to that, but I doubt that. I don't think so. Runenga, I think you have to cross-check your facts again. An IC bed does not cost 300 million. I think that's over-exaggerated or out of proper knowledge. And then Kermo Angelou says, thank you, Charles, and the group for the discussion. We really need to appreciate government hospitals and believing that we have qualified doctors. The message is too long. I won't read all of it. Then Nelson Tugume, thanks so much for appreciating. Nelson says, thanks, comrade. This is a very good show, fighting for equal rights for every Ugandan to access health care. Well moderated. Thank you, Nelson. And then someone called Beatrice says, thank you. Good evening, Charles, and thanks for the show. The healthcare system is wanting, and as you were counting the health workers needed per patient per day, 24 hours. Now, COVID, after putting on those white PPEs, you can only be in them for 4 hours, maximum 5. Meaning that in 24 hours, you can have about 6 different shifts. The number of healthcare personnel you had earlier counted. The government needs to plan for this. No, the government did not plan for the second wave. That's someone sending that message. And then there is another message from the person is called Jesus is Lord. The person says, Charles, thanks for taking the lead. I think the private medical practitioners are taking advantage of the weak regulatory policies in place. Why can't government come up with COVID emergency response strategy and put in place stringent regulatory mechanism to manage the private health providers and also investigate some of these private facilities? You may find they are owned by people who take decisions. I don't know about that. That's your suspicion. Maybe you have a reason for it. Walker from Aleb Tong says, Charles, good evening, and good evening to the panelists as well. I just want to thank God for healing me from COVID after 4 weeks of self-styled isolation without any professional health. That was really risky, Walker. And he says we can actually defeat COVID from home without going to the hospital. And then this one is someone called Jamil. Our Jamil is in a Ugandan who lives in Sierra Leone. He says, Charles, doctors in private hospital are as if they were praying, acting as if they were praying for the pandemic. My simple question is, do these doctors really have, do they have loved ones? Have they lost them? In Uganda, honestly, in Uganda, how can your wife, a child die and you ask for 150 million shillings? He's giving an example of a medical facility here in Uganda. And he says, I am right now in Sierra Leone and watching you. Thanks a lot, Mr. Muhanji, for that. I think let us now start responding to the way forward, and we see what is exactly the solution to these exorbitant charges that can be sustainable. Let's try to now, looking at the clock, let's do 2 minutes each if possible.
Okay.
And then if we can do a round, we shall come back to the issues again.
Charles, I think we need to be cognizant of the core of all the questions that have come up. They've all been centering around the private sector, and I think to give it 2 minutes may not pay it justice. So let me just allow me to explain the numerous areas in a summarized format.
Okay.
Now, the fact is that we touched on the National Health Insurance Bill, and we said that Parliament had pushed it up to have it assented.
Yeah.
Now, I want to be clear. Uganda Insurers Association and its members did not block it. Actually, we were having a lot of discussions around what was the new bill like compared to the previous versions that we had seen. So that was the understanding that needed to be had, because there are a number of things we wanted to be sure were for the regulations vis-a-vis what was going to be in the legislation. So the regulations vis-a-vis the legislation is one thing that they wanted to be clear on. However, they were not alone. The Uganda manufacturers also had some areas of clarification, as did the Community Health Insurance Group. So we really wanted to be sure that the version that was passed was able to accommodate both mainstream insurance to continue to exist, as well as community health insurance. And I don't think people really had a challenge with the version that the honorable members passed. Now, one of the things that we need to also recognize that when it comes to insurance, it does not cover every single thing. They're what they call exclusions. And the fact is, pandemics are exclusions, meaning that in Uganda, health insurers went an extra mile to cover the pandemic to a certain limit. But if you just cross the border into Kenya, the National Health Insurance Fund in Kenya is not covering COVID in any way, shape, or form, neither are private insurers. And that is why, like I mentioned in my initial submission, when you find the crux of the challenge of the bills that people are paying, ordinarily, if you are not looking at COVID and you're looking at all other conditions, you'd find that insurance would have come in for those who have it to cushion them. However, we're in unusual times. And I think the honorable member mentioned the value of medical tourism in India, because in India, health has become a real business. And because, in fact, when I used to work for an insurer, because I think we were talking about a knee replacement, and those guys do a knee replacement every 15 minutes. In Uganda, you can count hours between knee, so they become very fast, very efficient, and they can do it in a very cost-effective way. And that is how they've designed their system. So I just wanted to touch on that. However, let me jump to the crux of the issue of where's the money going? Because if you look, I think a couple of the newspapers broke down the basic ICU cost that I explained in Parliament yesterday. And if you look at, I can't remember if it was page 3 or page 10, but it says very clearly, and if you can do a quick back of a stamp calculation, you will see that 33% of the cost goes to drugs. And I think Dr. Juko, I don't know if he's still on the line, and I think we also explained it very well that a lot of these drugs actually are new drugs. So you'll find the drug of 7 million. I think we were talking about the injection of 7.5 million. That is a new drug. There are drugs that are being repurposed. There are drugs that are existing. In fact, even before the pandemic, ICU drug costs would have cost you 2 million shillings per day. Let me take you back over the border to Kenya. The fact is that deposits in Kenya, if you go to Karen or Nairobi West, or even Kenyatta National, you will find Kenyatta National, you're paying a deposit of 20 million before you even put your patient in that bed. So when we're talking about aggressive costs in Uganda, we need to be cognizant that costs are not high in Uganda. Their costs are high everywhere because critical care is expensive. We are a landlocked country. We are competing with a number of resources that are in limited supply. So even the suppliers we buy from, the cost is high. And I'd also just like to underscore that while we're saying that we're scrambling to buy these things, even in our own homes, we're actually competing with our patients to buy these products. Because if you remember, the Honorable Minister gave a speech on Friday where she said, please, do not just go out and buy azithromycin or dexamethasone and just start taking it as prophylaxis. No. You need a doctor's prescription because, Charles, when we're getting to ICU, we're finding a lot of patients are resistant to a number of first-line antibiotics, meaning we then have to go to second and third, much stronger and more expensive, antibiotics. And that is actually one of the cost drivers. Now, I've said 33% of the cost is drugs. Then, yes, we get to human resources. But it is not that we're paying them.
Let me interrupt you a little.
Yes.
But if you are saying, if now the common thing is that the cost of treatment is so expensive, why don't you expect me to just talk to a doctor, even a friend, and I would rather go and get, if they say azithromycin, Dexa, of course Dexa has now been, it is a dangerous steroid and has been advised against. Why don't I go to over the counter in a pharmacy and get these tablets, and I would rather, treat myself from home because I cannot afford 40 million in a week or two. That's the driver. One
of the things that has been put in place, in fact, by government of Uganda, has been 0800 numbers for people to call. I think Ministry of Health and KCCA have been very active in publicizing these phone numbers for people to call to get this advice so that they know this is what I should do. In fact, I even tested that line at one point, and I called and in fact, I was talking to Dr. Okello, the deputy director. Yes, and I was telling him, but the phone isn't, he also checked it was working. And we found that they ask you all the right questions to determine, do you actually need to go out to a facility for a test, or do you stay at home and carry out certain steps? So those structures are in place. What we are saying is that people should just not put in little pharmacies in their house where they buy 10 packets of Azithro, 5 packets of Dexa, because by the time they get into ICU, their sugar levels have been affected, for example. They have kidney injuries, meaning now the doctors that we're saying are overcharging. First of all, we have to also recognize the technical nature of critical care. It is not just like you just wake up and you go in there, you do a round and you leave. They are constantly monitoring these patients minute by minute. Every minute matters, because we've had the questions of why are you testing so many times in the day? Why do you have to do a liver function test? Because with a critical care patient, 1 minute is the difference between life and death. Let me tell you about private sector, because we were talking about costs. We've done costing studies, and I think also Ministry of Health did one to understand, and like I mentioned earlier, Ministry of Health said approximately 3 million shillings a day is what it's costing government. And you remember the projection I gave of an approximate basic patient in ICU in a private sector. This is somebody without kidney injury. This is somebody who is relatively healthy and young, 3.5. Now, cost data is an asset. And for us in the private sector, when we're pricing, we have to look at infrastructure. Some people are renting premises, renting equipment. We expanded very fast to be able to absorb the pressure. Because if you count the number of ICU and high dependency units that were in the private sector 2 years ago, they've actually increased because we were trying to respond to the demand. So when you park that... But
did you build the facilities according to the standard that is needed?
Charles, to be able to provide this ICU care, gentlemen, to be able to provide this ICU care, Ministry of Health sent a team to investigate, to look through the facilities, to inspect them. So we
To
didn't
all
just,
of them?
Yes, to the CTUs.
Do you want me to mention some of the hospitals?
Is it an accredited CTU?
It might not be professional for me to do that, but I can tell you, I reported some of them to some of the officials, and they said we have a problem with some of these private facilities. One, I can illustrate for you. I lost people, and you know, I would come close to getting the real information on my fingertips, including one where I participated in getting a body out of the mortuary when they had held the body. But in this case, in this hospital, I was told, because one of the things, is it done or who said, that COVID, as much as it is a medical issue, it is also a psychosocial issue. And they have told us some patients are actually suffering depression, but also anxiety, and leading in some cases to their death. Now, in this hospital, because of this issue of saying that let's rush and put together first a facility, and I think it is because we need to make the money as well, we need to have the ICU facilities, they put in one, I think in an open space, all the ICU beds, so a patient can see the neighbor suffering on oxygen, and this person dies, this patient has come in, they are scared, they see another person dying the next day, that same day 2 people have died, one in the morning, another one in the afternoon, they get anxious and are like, they are scared, I am also now going to die. And indeed, they will die. Why? 6 people have died next to them. What do you expect when you are seeing conditions like yours dying? Is that what we need for this country?
This is in the order of entry.
Let me go back.
In some cases, they even tell the patient, you know, they are discussing that there is a bed falling soon because someone has died, and another patient is hearing. Is that the standard for treating our people?
And let me tell you something about regulation. The fact is that all those, but this is an apartment. Why do they have ICU services there? There are others that have also noticed that are waiting till the patient is literally, it's not even a hospital, but they've got patients. And we've asked the regulator, please, because when this person is critical, they'll push them to the private sector, then we'll be told, oh, you know what, you're not providing at a good enough standard. And that is where the role of the community is, where you see these unauthorized treatment units. We need to speak up. But we talked about psychosocial support. IDI is actually supporting the training of health workers in psychosocial support for each other. There's also the call for life. And I think as Uganda Healthcare Federation, we're actually partnering with IDI to support them to engage with private facilities, to train them in this. Because call for life is an innovation, and I think some of you may be familiar with it, where a patient is discharged from a COVID treatment unit. They're engaged and some information is collected from them, and then they are called periodically to ask them, how are you doing? How are you feeling? What challenges are you facing? Are you being discriminated against? How do you feel? And that is the mental support I think the Honorable was talking about, to make sure that we don't abandon them at sea. But all this...
If I may interject on mental support, I think all citizens are now traumatized by COVID.
Indeed.
The information, first of all, the death.
Yes.
The rate of spread, but also the information we see, like falling sick now is the highest burden. Do you have 100 million on your account?
Exactly.
If you don't have it, how do you go to
land title?
Okay, you wind up. I need to bring in. Yes.
So let me wrap up.
But there was a question Honorable Dan raised. Why is why is second wave worse in exorbitant pricing than the first? Was the first different in terms of, you know,
I think the first wave, and I think there are people better equipped than I, even Dr. Juko, I think, is on the call. And I think even the Honorable Minister can also elaborate on this. But in the first wave, if you remember, we were dealing with the initial variant of what? COVID, right? Well, in fact, I think Donald Trump used to call it the China virus. Now, in February 2021, if those of you who are listening to the Honorable Minister's speech on Friday, She mentioned that in Uganda we have the Alpha variant, which is the UK one, the Beta variant, which is South Africa, and the Delta variant, which is the India one, was found in April. And then right now, there's also the Eta, the Nigerian one. 3rd of February is when it was identified in Uganda. Then we have the Uganda one, June 2020. Now, when you're talking about
how many variants do we have in Uganda now?
She said 5. Now, I'm not going to speak for the Honorable Minister. I think you can have her here and she elaborates for herself. But what I can say on that point is that the Delta variant is more infected. It's more, it infects at a higher rate, and the patient deteriorates differently to the first wave. And these are facts. So how you interpret them is really up to you. My job here is to what? Present the facts. Now, before I close, Charles, for you to pass over to the next person, the quality of care in the private sector hasn't changed. And what I really want to underscore, the nature of private sector is to offer ambience and an experience to the patient. It is priced that way. It is designed that way. The world over. In fact, I was having a discussion with somebody earlier to say in England there are 500 private hospitals. 500. To sleep in the bed before they even do anything medical new is £275. Not many people in England can even afford that. Before I even go that far, I want us to look at just next door in this region here. You go and ask Aga Khan how much it is to sleep in their bed, Aga Khan Hospital in Kenya, just to sleep there before they do anything on you. It is a lot of money, and that is the nature of what? Designing your model. But the private sector in Uganda, especially private hospitals, have not been profitable for a long time. And that's why if you look at the older ones, they actually now have equity investors that are enabling them and investing in them in the hope that the books will turn around.
Okay. Let me bring in Dr. Muhereza. Now I'm going to reduce your minutes. Way forward, from perspective of the Association of Medical Doctors, medical workers.
I think in the interest of time and in the interest of emphasis, to me and to most of the health workers out there, we really know that the best way forward is that we must flatten the wave. Number 2, we must get better prepared next time. These are the 2 cardinal points of a lockdown. You get a problem, you make sure that people are not infecting each other, but also you prepare to handle the few that comes to you. Next way forward, we really know that the only way we can get out of this is vaccination. Look at how we are. We haven't even vaccinated 1%. So, in the next 2-3 years that we may get even vaccination, because we have seen bookings of the rich countries going even up 2023, 2024. In other words, we are 3-4 years to get enough vaccines for ourselves. Now, this is the hard truth. Somebody who is watching us, we must prepare to wash our hands as much as possible and prevent. The next thing is the few that come to us. We must prepare and be much, much better than the way we are. That the oxygen plants that we are set up must work. And when we are asking this, Honorable Mhanga, Minister Mhanga, when we are asking this, it's not that we are criticizing, it's not what we are. We expect these things to work. And I'm putting on this yellow tie, Danik Moshono, my history. It's just that because when you are inside this, when you are delivering a woman of COVID and you don't have PPE, and you know how you are going to maneuver around that, sometimes we don't, there's nothing much of that other than becoming angry. When you are touching people with, because the next patient might be a COVID patient, and you don't have gloves. And, you know, we talk about PPE and we think these are exotic things that are going CTUs, but even the next doctor, the next nurse must be protected to really say that he can save another life. The rest of the rest is that we must prevent the rice bowl syndrome. We must appreciate labor, we must appreciate effort, and we must know that unless these things can make sense in terms of the bottom line, then the next patient will not get somewhere where to stay. This is the naked truth. I want to tell you that 27% of anesthesia officers are filled in all of the government. Why? Because these are the first people who enter theaters. They are the last one to get out. In fact, we usually laugh at them that they have never seen sunlight. And then you pay them the way you want to pay them. Then they drop out slowly by slowly. So if we continue to neglect these things, and we must tell you these things, Honorable, if we don't tell you these things, maybe you don't even know. But we must make sure that this rice bowl syndrome that we must harambe, hypocritic oath, no. We must face life and face it and prepare better. Thank you very much.
Thank you so much. Sarah.
What is critical for us as a country is protection of the dignity, welfare, safety of patients and healthcare workers. When you strip people of their dignity, including acts like detention of dead bodies, yet hospitals have ways of recovering money, including obtaining commitments, discharge commitments, and court redress. So may I think my first call to whoever is involved, let's not lose our humanity as a people. Let's not strip people, fellow citizens, of their dignity, even in death, that you are detaining dead bodies. And I wish, as a public defender, I wish to really call upon citizens to sue hospitals in line with Section 121 of the Penal Code, and we make sure people detaining dead bodies are arrested. There are ways of recovering costs and debts, and hospitals should not dehumanize our people. My second call is to government. We have seen really the supplementary budget for COVID. It is one thing. I don't want to miss an opportunity of the Honorable MP here, who is also on the COVID committee. That supplementary budget that was approved by Cabinet really should be reworked. And in that supplementary budget...
Hasn't it already been released?
Whatever it is, still, it is really one thing, and that is part of the problem. Honorable, my sister, Honorable Margaret Muhanga, we are not going to stop calling government to act responsibly and to be accountable to citizens in the management of this pandemic. So government should subsidize treatment in private hospitals. Let them buy essential drugs and PPEs. Let that cost be borne by government.
By the way, talking of PPEs, there is an Ivan on Twitter saying, Charles, these private facilities are claiming to pay risk allowances and PPEs. The only PPE provided are masks and, if lucky, face shields. No risk allowances. When you demand, they tell you you can resign. You find time and talk to those people working there.
That's case
anyway,
by case.
let me conclude my argument. So the third call, Charles, let's let the president please assent to this National Health Insurance Scheme.
I agree with you.
So that we remove barriers of universal access to health care. It is urgent, it is critical, it is needed yesterday. Lastly, let Parliament enact laws that regulate costs for treatment in private hospitals during the pandemic and at national emergency responses. I thank you.
Thank you. I need to bring in Dan, but Honorable, you need also to respond more substantially to the issue that was raised. Someone sent a message that Dr. Muhereza raised the issue of comparing parliament and politicians to the medics, and and the person was saying that we just brushed it off. It is a serious issue of the system problem. Honorable Dan, the truth of the matter is also, I had it when I was talking to some of the doctors, and this is what they said. And for me, it's one of those issues of accountability as well of our leaders like yourself. The question you know, there is, some doctors had the audacity to even say that, look, when you MPs, they were referring to your predecessors, of course, but you are now, you replaced them, that when you MPs have been adding your allowances and salaries beyond what the ordinary person can fathom, can even think about, what service were you offering, and that now you are asking us to present what we are charging for? That you MPs should not be the people to ask them that you are as themselves as well. You hear Dr. Mwereza, this is their Secretary General, by the way, that MPs are worse in exploiting Ugandans, that politicians are worse in exploiting Ugandans. And so when you see people refusing, Gobi knows, yesterday he was facing a wrath of the ordinary people when he was saying, how can people be so many out there when there is a lockdown and private cars are not supposed to move? Are these all essential workers? And I followed on social media how they took him on. People are saying, we are also looking for survival. Who do you think you are? That must be the only person moving around. So there is a certain Ugandan frustration around this thing that COVID has exposed all of a sudden. And we need to keep responding to them and facing them now head on as a solution for the future. Dan, you can respond.
Thank you very much, Charles. First of all, as we conclude, I want to thank Grace. I think she has tried to do her work. You know,
just try.
You know, they are very tough times. But when someone...
She was underpaid.
When someone...
Not easy times.
When someone withstands some of these, I mean, they withstand the pressure, and they put a face for the fraternity. I've been a spokesperson, so I think, thank you, Grace, for doing your work. It's not necessarily an easy work to do. Two members, I think it should be on record. This should be on record that all medicines and medical supplies are zero rated in terms of tax.
Oh.
Yes.
Zero rated.
Yeah. So even the issue of prices, high prices, must be interrogated further to know what causes this. And of course it takes us back to the professor's point of regulation. The issue, and this I would put it across to my senior colleague, my sister, Honorable Muhanga, now that she's in Ministry of Health, we should critically look at issues of regulation. In other countries, you don't just walk on the counter and ask for any medicine without prescription. Here, you can. In other countries, even when you're buying a medicine, there is a price tag to each medicine at the pharmacy level. And that makes it easy for supervision if someone is making rounds at the supervisory level to know who is exploiting the people. But now we get a blanket statement of things are expensive. You can't know where they are expensive from, where, I mean, that's why I appreciated the effort of my sister. Now, when the public says, when you see the public says MPs, I don't know, the doctors are saying MPs are bad. So have you got an opportunity as doctors to compete with MPs in being bad? Is this the right time for you to bring out your competitiveness in terms of how bad you can beat Ugandans to the extent of withholding dead bodies? Is that how bad you can go? Now, if MPs are bad, and the country had depended on you as doctors, now, for us, we were bad with human people living. Now for you, you're bad with the living and the dead. Is that how bad you can be? So that you're able to compete with the MPs and then you outcompete them in their badness. Because when you become this bad to the extent of being bad to the dead, then who will guide the country? Alternatively, if MPs are that bad, which I even don't want to refute, if you kept good, you would repress the bad MPs and reshape the agenda for this country. But now, if you can be this bad, I get scared. Because for us, we have been bad without corona. Now, for you, you know, when you're bad at the mortuary, you're very bad. So we have got, it's on record that this country has got worse people than MPs. Those doctors, not all of them, some of these doctors who are withholding dead bodies. And by the way, these things we are laughing. But I think we shall reach a point where we shall lose our patience and mention some of these facilities. Because the records are there. Records are there for those facilities that are withheld. Because they are good doctors. Certainly they are good doctors. Like they are good MPs. We have had MPs that have put their selves on the line for the betterment of this country. And they are good doctors. But the bad ones should also be highlighted. The difference between us and you guys, for us we have an expiry date every after 5 years. Now I get scared. Yours is open-ended to a lifetime. When you decide to be bad, you can really start taking our organs. It is very unfortunate. By the way, this one, I am very passionate about it. If there is any person in this country who should never be bad, for the sake of this country and the people of this country, is a medical doctor. He should be. That then would mean that we should get a machine to test hearts before we admit students at Makerere. And if we detect that you are going to be as bad as MPs, you don't deserve entry for medicine. Lastly, I think as a country we need to restructure a few things. We need to refocus on health insurance scheme. And if there are issues that we must rectify for the president to ascend, then it should be done. But you see, these private actors are also very powerful, that they can hold the president and he doesn't assent to such a critical thing. And now Grace is here massaging us, we were analyzing. So when you analyze it, what did you analyze? Now, when you analyze and the COVID is taking all of us, you're giving us statistics of the dead every day. Isn't this analysis over? For sure, for us to get this thing assented to. And as you know, our president respects the private prayers, that he doesn't want to rub them the wrong way. Until they go back and give him their word, he may not assent. So Ugandans, let's together put these guys in, on, at least we know where the problem is. These guys told the man, don't put the signature. He is holding his kindly grace now. The same effort you are using to convince us here, kindly. Then finally, the issue of regulation. This really should come in force by our Ministry of Health. This should be one of the strongest departments at the Ministry of Health. And this shouldn't be in book only. It should be in practice. But also, we should support the private health players in terms of giving them incentives. One, cheap loans. I wouldn't mind the money in UDB, even if you say half of it should go to these private actors at 0 interest. They only pay back the principal in a period of 5 years. If that can guarantee us that it shall significantly change their bad heart, granted. Me, I have no problem. And then finally, and I think my senior colleague is following us, the issue of the ambulance. I can tell you, if we did not have the private ambulance system, which is also ad hoc, it is at an individual facility level, would have had a bigger problem. There has been an improvement in the city, in the urban, but generally as a country, there is a big challenge in terms of ambulance management, ambulance service management, and that's why you see even MPs with their bad hearts, they could not stomach that, like you call it, and we have gone into buying ambulances, even when they lack some of the components that an ambulance would have. But desperate times need desperate measures. Better have one that lacks, like some of our ICUs, but it is there, and it can quicken the person to the next level of care.
Okay.
Thank you very much.
Thanks a lot. Thanks a lot, Honorable Dan. Honorable, let's start with Honorable online. Let's start with Honorable, no, Ramadan. Ramadan, let's start with you. 2 minutes. We have now crossed into the new day. You have had the issues, very interesting issues, including now these fellows are comparing themselves in who is worse,
That is misinformation.
who is better at being bad. Who has better badness?
I've heard, but I will comment on the issue which you yourself you commented on, my tweet.
Oh.
You know, my tweet, you have decided to choose the side of the elite, whom I called out for driving out. There are so many thousands of those who were supporting the idea I was floating around, that government is locking down the poor and leaving the rich to drive around. And this inequality also needs to be addressed. Actually, some of these younger people were saying, good enough, it is the rich who are getting COVID and who are going to the expensive hospitals. We don't need to see this happening. And finally, I would like to really say that COVID has helped us to expose the massive market failures that we have in the private healthcare system, let alone other areas of our society, education. I don't know where children are going after this lockdown, because schools are on notice. They are going to be taken over by banks, and these banks might, to people who are going to turn them into lodges or other things. And that points to the issue of how do you entrust much of your typical social services which bring equity, because you know the only guaranteed way of equalizing opportunity is education and health care. But these were left in the hands of the private sector, and the private sector has been borrowing money at market rates. Sometimes when you are blaming these health care providers, please note that they are borrowing money from banks at 20% plus interest, and they have to use that money to provide these ICUs, and they pay back these loans in 5 years, or else their hospitals are going to be taken. So they are harvesting as much as they can quickly, using this opportunity of COVID to be able to repay these loans. These are the conversations we need to have. How do you facilitate the society to provide what we call basic services? I always tell people that the legitimacy of the state depends on two major issues: providing good services to the people, as well as jobs, because it is jobs which provide people a livelihood. So this emphasis has always been put on government failure. There is also private, or what you call market failures, which must be addressed. it is not very sensible for us to leave the society on the mercy of markets determining what should be provided at how much. You know, if you leave me to ask how much I should ask, I will ask for the highest possible, and this is what is happening while the stock lasts. In this case, stock in terms of the COVID pandemic, which this private sector know is a seasonal thing, is going away, and they are making money. Everywhere in the world, this is what has been happening in countries which chose this type of the system we are running. We need to review our system. I've had the honorable member and Sarah emphasizing the issue, and also I think the younger lady from the private sector, the issue of insurance. But you know, insurance, I don't think insurance would work on this COVID, insurance in the pandemic. I don't know whether those people who have policy were being treated on insurance. I don't think so. Much as we need the national insurance, we also need to regulate the private sector to provide services to the people. I thank you very much, and I would want to call upon Ugandans to really stay safe. I know, Charles, you are emphasizing the issue of people driving around, and they are saying if you want us to be the only people to be locked when other people are driving, many of us are working home. We only get out when you people insist on us to come there, for example, in the studio, and we come. But now I refused to come. I've been in my hideout so that I can use the online means to reach out to the world. COVID is real, and you can see the costs we are discussing, how many people can afford this money. But let government also, if it is announcing lockdown, let it not be discriminating. There are people who are not being locked down because they have money. For them, they are enjoying lives, and they are causing more infections when the poor are being chased out of downtown. If we are under lockdown, let's be under lockdown. If it is to reopen the economy, let it be reopened for everybody. Thank you.
Thanks a lot, Gobi. Let me bring in Margaret Muhanga. Good points there. Margaret, way forward, finally. What is going to be, in your view, are you going to move for interrogation, the quality assurance checks with some of these health facilities? What is the way forward?
Well, Charles, I want to point out a few things. The first one, actually two things only. The first one is that the priority of government in this kisanja of securing your future is to raise the pay of scientists. And now I'm glad there is Honorable Dan, who is also on the COVID subcommittee of Parliament, that when this issue comes up in the Parliament, please support it. Let us pay scientists more, because it is scientists that will transform these countries, these poor countries. Look at how we are suffering with getting vaccines. Some countries were holding vaccines, the money is available, but the vaccines are not available on the market, yet they will be expiring by September, but countries are not selling, and it's their right. And so we don't want to be held at ransom all the time. Africa must rise. Let us build our hospitals, pay our scientists well. Having said that, there's another thing that has been paining me so much, the hunt for money for the sake of it. It's not only Ugandans, it's everywhere. Capitalism is exploding. I even wanted to speak before Ramadan Gobi, the economist, and he tells us capitalism is exploding. It is the world over. Here in Uganda, I employ a few young people in a few things I do outside my work. They employ somebody today, tomorrow they want to buy a car, the other day to build a house. You find young people who have just started working in the civil service, their salary is 1 million, 1.2, they have 20 houses in 3 years. I've been working for 27 years. I live in a very little house in an estate. How come people want to make money for the sake of it? Even if you have 20 houses, you can only sleep in one house at a time. Even if you have 20 cars or 10, you will drive one at any one time. They hunt for money for the sake of it. Let us go back to our basics. We leave basics on which to survive. We need basics on which to survive. Life is not about money and things of the world. One day my brother came to visit me and admired a little blanket. You know these bed throws that you can cover yourself when you're on your bed. I refused to give it to him. After he left, I followed him because we live in the same estate as Andrew. I sent him a new one. I said, I even had a brand new one. Why am I even having two? Let me give it to you. I felt guilty that I failed to share. Why should people want to make so much money and moreover ill-gotten? You steal it, you go buy so many things, you won't even use them. You will take your children to Canada, they will even be cursed. And they will drink in jug and come back with nothing. Yet you sent them to go and study. So let us be Christians. Because I know this is a Christian country, 85%. And it is the Christians committing these offenses. Let us be Christians. Let us share with people who have nothing. This pandemic has taught me so many problems. Whenever I am coming back home, I stop and talk to people that sell small merchandise. And then I see children who cannot even buy a sweet. They even tell you at home there is no food. You buy 10 kilos of posho and give them. Let us be humble. The world is not going to crumble on us today. You can't eat 20 chicken in one day, even if you have too much money. You will eat one piece or two and your stomach will be full. No one eats an elephant and drinks a lake. No one. We only can eat that enough. So Ugandans must come back to our own lives and stop hunting for money for the sake of it. Building empires that people will see you. So what? They may not even see you. You may even see yourself. People can even run out away from you when you are too rich, because who will come? The rest of your friends have remained poor. So Charles, capitalism is exploding in this country. People want money too much. Young people cannot be employed. Everybody is fearing them. If we can get back to live on our basics, we need a roof on top of our head, to have enough school fees for our children, live a comfortable life, and that's it. We are even better off than those who have too much money and they cannot sleep. Bill Gates went to Brussels, they were hitting him with rotten eggs. People are tired. They are thinking that these are the people who are bringing all the diseases in the world, and all the pharmaceutical companies are theirs. So they want to control us. Can you imagine? Now, with your own money, you are having problems. You can't go anywhere. The last point is that I will be sworn in tomorrow, and I want us to restart this health system. I think we can do better. There is a lot being done, of course, but no one speaks about it. So much being done in our health sector. Moreover, in government hospitals, up to the health center tools. There are no private hospitals, by the way, in the villages. When I was in Fort Portal during campaigns, I did so many COVID tests because I wanted to test my driver and the PA who I used to move with all the time. I had never paid even 1 shilling for a COVID test because there was no facility that was asking for money. I found this in Kampala. And I asked, I said, but in Fort Portal, I wasn't paying. How come I'm paying in Kampala? Well, you know, Fort Portal, there is a regional referral hospital. There are many referral hospitals here. Even the national one is here in Kampala. They said, oh, you see, you know, private players are many in Kampala. We were paying 180,000, 220 for a COVID test. Yet people in Fort Portal, no one pays because there is no way you can pay for a COVID test. So you see these discrepancies happen only here in Kampala. That's why people are suspicious that maybe these private hospitals are overcharging people, confiscating dead bodies, and maybe belonging to senior officials of government, that they will not even put a regulation because these are their own hospitals. So for you people in government, MPs, support all these policies that are coming to government to help Ugandans. Everybody needs to be better. Let us have insurance. Maybe health insurance can help a lot of souls. Not only people in big offices, but a lot of souls.
Margaret, we need to get out of the studio. Have I lost Honorable Muhanga? Sorry, I've lost Honorable Muhanga, but the point had been made. I saw Dr. Edrin. Dr. Edrin, in 1 minute, just wind up, because Grace had already aired out the sentiments, the thoughts of the fraternity. But in 1 minute, Dr. Edrin.
Thank you so much, Charles. And listening to all the great people seated in the studio, I think there's a lot that has been learned, definitely. My only humble request through everything we've gone through has always been to involve the private sector most of the time when certain decisions are made, because that helps a lot in going an extra mile in reducing some of these things, because we're more reactive than being proactive. When most of the decisions are made, I think the private sector is left out. And then later on, the private sector comes up because maybe they need extra help. So I'm thinking that one of the things that will help is involving the private sector at the beginning of the discussions and have them actively involved. Then, of course, I think regulation becomes also easy when the private sector is from the beginning. And then lastly, I think vaccination is what will lead us out of the pandemic. We know that we need about 80% to 90% to get herd immunity as we know it. We know how much, of course, vaccination, how many vaccines we need. The target by the Ministry of Health would definitely help if they have, at least they get to vaccinate about 9 million people. That will help, because those are the numbers of people who are above 25 years. As we have seen, that that's the population of the people who are dying. So chances are that we shall be able to have probably insignificant deaths if we are to say, if we targeted to have such happening. So we know even the cost that will be involved, probably around $156 million. So that's something that can come up and happen. We are hoping that we don't have to go through the third wave, and then you call us back here for another session about the same, but we definitely have to prepare because we've seen other nations which have gone through the extra waves, the third and the fourth waves in some other countries. But thank you so much again.
Thank you so much, Dr. Juko Edrin, the Head of Medical Services at Victoria Hospital. Thanks a lot to Honorable Margaret Muhanga, the Minister of Health in charge of primary health care designate. Her swearing in is tomorrow as minister. And thank you so much, Gobi Ramadan, a panelist on this show. Of course, Honorable Margaret is also a panelist. I pray that she will continue being a panelist even when she takes on the assignment, the new assignment given to her by His Excellency, the President. And I want to thank you all very much. Honorable Dan Kimosho, my good friend since many years ago in journalism, and good that you are now in Parliament and you can advocate for the ordinary Ugandan. And for me, that's what is at my heart, that we should provide health care for every person. The standard should be of a basic provision should actually be for the ordinary person who is the poor person. The rich person can always choose to go to Nairobi, choose to go to South Africa, they can choose to go to the US, Canada, UK, or wherever they want. But can the ordinary person, I mean, even afford just a day if the cost that is being talked about just average is about 3 to 4, 5 million a day, you know, and we need to, leaders out there who are watching, you need to seriously think about that. And I think our value as leaders, as you know, as responsible citizens, is when we start thinking about the ordinary people that we claim to serve, the people who vote for us, the people who are the vulnerable. And for me, that is my passion. And I pray that we can take that very importantly. So I want to thank you so much, Dan. I want to thank you, Sarah Brete, for always holding up to the task of asking for accountability from our leaders. Thank you so much, Dr. Muhereza, for representing the people. This morning you were in Nakaseke, and you had to come all the way to participate in this show. It also tells how much you have the passion for this, for your sector, for the medical field. Thanks so much, Grace. Like Dan has said, you
say something.
Like what?
I wanted, first of all, I just want to give my condolences to all those who have lost somebody. But I also want to thank him for his valiant attempt to distract us from the facts presented. I also want to appreciate the partnership we have working with government on these solutions. The only way forward, this is a mixed health system. We're stronger together. We need to work together.
Yeah. Thanks a lot, Grace. And I know that we shall have these discussions going forward. Like Dr. Edwin has said, we pray. I didn't know that there is a possibility that we can dodge the third wave.
South Africa is in the third wave. South Africa is officially in the third wave.
Kenya is on the fourth.
So the only dodging you can have is to be immunized.
To be immunized.
Because people have opened study here, people are taking off restrictions, and we have even seen that people are immunized. The few here are faring much better than those who are not.
So we pray for the money to be got to get for us the vaccine. Someone, Mivule Ronald, this was an interesting one, said, "Hello, Charles, when our parents were in the bush, they ate people's cows and paid later. We are now at war. Therefore, government should take over these private hospitals and use them to treat our people. We shall pay them later." I wanted to, Honorable Margaret says, sorry, my battery ran out unceremoniously. Sorry, Margaret. Thanks a lot to my producers, Morris, Ivan, Fred, the rest of the team, Bills, William. Thank you all very much. I really ran on your shoulders to sit here and ensure that the show has good content. I really appreciate all of you and your time. Thanks a lot to the technical team here, led by Margaret, and all the other camera persons who are on set. You make this show happen. But as always, as always, I really preserve the best gratitude to all of you out there who sit in your sitting rooms at home to watch this show all over the country. And for your time, I want to appreciate, and especially those who send messages, take time to share with us their questions. We really cannot appreciate you enough. Thank you. God bless you all. Take care. COVID still exists. COVID is dangerous. COVID kills. Can you take care of the standard operating procedures? Let's follow them. There is a standard request to all of you. And that's from Ministry of Health. They say it starts with you. This is not about anybody, not about the president, not about the minister. It's not about anybody calling you and requesting that you follow the standard operating procedures. It's about your life and the life of the next person you are sitting to. So let's ensure that we follow. We wash our hands with soap regularly. Let's sanitize as much as possible. Let's ensure that we social distance, and that social distancing includes if you don't have what to do in a public place in town, don't go there because it's dangerous. You could pick the virus from there and it can kill you. Young people, I know many of you still say that we can fight COVID. Yes, you can fight COVID because your immunity might be stronger, but that is also debatable because many of you do not know whether you have HIV. Some of you don't know whether you have you know, an underlying disease, you might have high blood pressure, you might have diabetes and you don't know, and by the time you are going in for a checkup or you are not feeling well, it could be late because of that, and it will be problematic. But most importantly, you could actually, even if you were strong, infect your older parent or your grandparent, and you will live for the rest of your life guilty that you participated in killing someone dear to you. Kindly avoid public places. Let's take care of ourselves. God bless you all. God bless Uganda. Bye-bye. Good night.